All right. Let me just. Can you all see my screen? Let me just share again. Yeah. Is it okay? Can you all see my screen?
Yes,
Okay.
we can.
Okay, thank you so much. Thanks for responding. Okay, hi everyone. My name is Marian and I'm the co-founder of Calibrate. So thank you so much for joining tonight for our webinar. So I do see a lot of new names joining us. We do have users from Telegram channel, meetup.com, and even referrals from friends. So for those who are new, we are actually organizing webinars on a monthly basis. So do join our Telegram channel to keep a lookout for new webinars. So Riti can pop the link in the chat below. And yeah, we'll just get started quickly. So today is a very interesting topic because most of us would just assume that chest pains come from the chest, but there are also other potential sources for your chest as well. And of course, that's for Gan today to discuss more about that. He's a physiotherapist here. So, and also some general housekeeping before we get started. Feel free to drop any questions in the chat if you got any questions. So Gan will address that at the end of the webinar. And of course, feel free to unmute yourself to ask questions during our Q&A session. Yeah. And for audience here, we could, do you mind muting yourself as well? Okay, thank you. Yeah. So just to, introduce a bit more about Gan, he is a physiotherapist with, 9 years of experience. He has a physio clinic called the Rehab Studio, which was founded in 2020 and has corporate companies, partnerships with P&G, and also offers clinic-based and home-based physio. So maybe Gan, would you like to introduce more about yourself and the clinic?
Hi, thank you, Marianne. Hi, I'm Gan. I'm physiotherapist from the Rehab Studio. My clinic started last year, February, just when COVID started. Basically, my clinic start with providing home-based physiotherapy service for last year and slowly expand into clinic-based rehab. We have a clinic at 79 Anson Road at Tanjong Pagar area, together with my two other physio partner, who is Bao Xian and also Jolene. Myself mainly specialize in elderly rehab, pain management, sports rehab, and also for stroke rehabilitations. My partner, Bao Xian, she does dry needling, pain management, and also Jolene, another physio, she does cancer rehab, elderly rehab, and stroke rehab. So we have a wide range of physiotherapy services, and each of us have different specialty. But we help each other as well. Yeah, I think that's about it. I will hand over to Marianne at a minute.
Yeah, sure. Thanks, Gan, for the introduction. So I would also like to, take a minute or two to mention about Calibrate. So Calibrate is a new digital platform in Singapore for, users to find and book pain relief solutions or to optimize your well-being. So some of our practitioners include chiropractors, sports massage, TCM, osteo, and of course physio, like Rehab Studio, who is on board with us as well. So we actually recently launched our website, so feel free to check us out at calibrateapp.co. And yeah, so this is just the gist of our platform. And in short, we're also the platform which connects both practitioners and users like yourself. And we also hope to solve the big problem where users are unsure of who to go to when they're in pain. So everyone can say they solve everything, right? But on our website, you'll be able to search by your pain conditions. So for example, you've got back pain or neck pain, you will be able to see what kind of practitioners are the most suitable for you. So that's just a quick summary of what Calibrate is. Yeah, so without further ado, I will just hand it over to Gan, who will speak more about the topic today. Yeah.
Thank you, Marianne. I forgot to share something just now. So I will share my screen later. For my service, for home physiotherapy, mainly we are targeting at those clients who have problems going to the clinic. For example, stroke patients, patients who after surgery, they have problems to travel to the clinic. So for the initial phase of their rehab, we do provide a home therapy service so they don't have to spend effort and extra money to travel to the clinic. But then towards the end, when they from our rehab service, then they can travel to the clinic for more clinic-based service and to use equipment at the clinic. Okay. To start the topic today, I share my screen first so you can see my slides. Thanks Calibrate for the opportunity for this webinar. Initially, when Marianne asked me what topic do I have in mind, I was thinking a lot on like other pain management, but there was something that I have always wanted to share with the public ever since I started working in hospital, which is chest pain. And with this vaccine coming in, a lot of people start talking about chest pain. So let's talk about chest pain today. Why this topic? Maybe before I start here, each of you can tell me whether any one of you ever experienced pain around your chest area, and you will start to feel panic and thinking whether are you having a heart attack. And if you have, then maybe you can share some experience in the chat box. Then I will have later. So why this topic? First reason, pain around chest area can be something very disturbing, both physically and emotionally. Imagine you're having a chest pain and you are so worried that you're not sure what is it and what should you do. Okay, so hopefully you can learn something for the topic today. Second, heart-related pain, not necessarily heart attack. It can be like a small heart attack. Might not necessarily happen at the chest area. We'll share a little bit more later, but it can be at other area other than your chest. And the third point, pain around your chest area, again, might not necessarily a heart-related pain. So it's a bit confusing, right? You have pain there and you're not sure where is it, and you have pain somewhere else, then you're thinking whether it's heart again. So hopefully we learned something today. If you have questions along the way, you can type in the chat box, or you can save it during the Q&A and ask me later. Okay, feel free to unmute yourself to ask the questions. Any experience in the chat box?
Yeah, Gan, someone actually PM us, and we have a few PMs who said they have chest tightness. Yeah, and some of them also mentioned, yeah, they're also experiencing chest tightness. So most of that, I think some of our viewers do experience that. Yeah.
I hope you're not experiencing now, okay? If anyone reply that not now, okay? Maybe you experience like a sharp pain, a quick pain that it go off. But later I have a workflow to tell you what to after you knowing more about this, then hopefully you can know and feel a bit more calm when you experience this pain. Okay, let's go to my third slide. Okay, a study from this guy, I don't know how to pronounce his name, sorry. A study on chest pain cases presented to emergency department found that 38% of those cases who present to the ED are related to heart condition. So you have chest pain, you go to ED, they found that only 38% are heart-related condition. For the rest, 30% is related to gastric reflux, 28% is related to musculoskeletal pain, which is what I will share more on today. 2% is on lung-related condition, and others account for other 2%. Okay, so you can see that only 38% is related to heart, and the rest it might be other things. Okay. However, I'm not saying that you can skip your emergency department visit when you think you should. What I'm saying that is calm down when you have chest pain. Potentially it can be heart related, but it can be also non-heart related. Okay, I'm not asking you to don't go to ED because it can be other thing. I'm saying continue, but hopefully this information can let you have a peace of mind knowing that it's not 100% a chest pain when you heart related pain when you have a chest pain. Okay, I hope it's not too confusing here. Okay, any question you can always type in the chat box. Contents for our today's webinar. First one, I will share the signs and symptoms of heart-related chest pain or heart attack. And heart attack that doesn't occur in the chest area. Signs and symptoms of bones and muscle-related chest pain. And last, we will do some simple exercises to not just able to relieve, but also prevent you from having those bones and muscle-related pain around your chest area. Not prevent a heart attack, okay? It's prevent a pain that due to your muscles and bones problem. Yes, you can prevent heart attack by doing more exercises. Okay, this is the workflow here so that you don't get too confused later when you go a bit deeper to the topic. And first thing, I want to clarify that you do not need a doctor referral letter to see a private physiotherapist. But if you suspect you have a heart-related pain or heart attack, this is something that you should do. Whenever you suspect a heart-related pain, it's very, very painful. Then you straight away you go to either call ambulance and go to hospital if it's really painful around your chest area. Don't think so much. Okay. Or the pain is quite mild, but it comes with other symptoms like you have difficulty breathing, you feel like you're going to faint, you have cold sweat, vomit, and other symptoms other than the pain itself. You have other symptoms. Also go to hospital. Okay. Do not because of this webinar you think you don't have to go to hospital because I said it's potentially in other things. Okay. The workflow stay the same. Go to hospital when you think you should. Second, at the side here, another arrow. If you only have very, very mild pain, do not have other symptoms, but you suspect it can be a heart attack, can be heart related, also go and see a doctor first. And let the doctor do the clearance for you. They can do ECG, they'll do a bit more reading and assessment on you to clear whether do you need to go to hospital for further follow-up or to let you know whether is your pain really just bone or muscle related. Okay, if they say the pain is really bone and muscle related, then you can start to see a physio and let us help you with your pain. Okay. Yeah, I hope you understand this part. Disclaimers. So it took many years of study and experience to diagnose a chest pain, whether it's heart related or muscle related. So this one is just a general information to improve your health knowledge. And I'm not your physiotherapist. I have not done any assessment on you. The contents of this webinar are not intended to be a substitute for professional medical advice, because to be a professional medical advice, we need to do a personal assessment on you. And if you are in doubt, please always seek a personalized advice from a doctor or a therapist. And if you're not confident in performing any of the exercise later, please do not attempt. If you think you have a medical emergency, please call 995 immediately. And reliance on the information on this webinar is solely at your own risk. Okay? Like what I shared just now, chest pain presented to emergency department. Other than the 38%, 28% is due to the musculoskeletal pain, which I will share more today. Okay. So we are going to just a little bit information on what are the possible structures that might cause the pain to your chest area. So your rib cartilage, this soft bone, light blue color here. In layman terms, we call it soft bone. When you eat the chicken, you tend to see the whitish thing, soft bone. Muscle strain around your chest area. You can see our chest area actually covered by a lot of muscles. Any strain around this muscle can cause you chest pain. And without all this knowledge and information, it tends to cause people panic and thinking they have a heart attack. Joint pain. You see here the spine, thoracic spine here. Problems here can cause you have pain also. And also the connection between your sternum and the ribs, we call it joint also. All these problems can cause you to have pain around your chest area, and also your cervical and thoracic spine, which is at the back. So all these structures are potentially giving you a pain around your chest area, and potentially a panic where you think you might having a chest pain, or cause you think that you might have a heart. I will just check on the chat box on and off to make sure there's no questions coming. That's good. Now we move on to our main topic today. signs and symptoms of heart-related chest pain or heart attack. Okay, we have seen a lot of drama, TV, movie, whatever. They say they have chest pain and they start holding their chest. Okay, but does anyone here know how does a chest pain feel like? Okay, maybe you can just share with me the answer in your chat box before I share the answer to you. Anyone know how does a chest pain feel like? Or you can unmute yourself and just tell me. Anyone, I hope you don't experience, but maybe you learn it somewhere. Burning. Yes, burning is one of it. Tightness, yes. That's why you always see people squeezing very tight. They feel very tight here. I'll reveal the answer now, okay? Yep. So the type of pain you will experience when it's heart attack is constricting. Feel like squeezing, tightening. Okay, second, squeezing. Third one, burning. And last one, heaviness. You feel very heavy over the top of your chest here. Okay, so all this type of pain, it tends to direct the clinician, the doctor, to say that you are potentially having a heart attack. So all these are potentially you are having a heart attack.
Gan, someone actually also shared that his experience. He went to A&E. I think the doctor said reflux. Yeah, I think this is his experience with chest pain.
Reflux, yes. So reflux is under, you see this slide? Yeah, this is under gastric reflux, 30%. Yeah, quite a lot of people get sent to E&D for this, but it's good to go and get a clearance at it. So this is the pains that linked to more heart attack, and pain that are not related to heart can be this one. Down pain that is muscle and bones related. The feeling will be down, achy. Older people tend to say 身体酸痛. Okay, knife like something is poking you, sharp, stabbing or jabs. So look at the picture here. It should be something more sharp pain instead of the burning and tightening and squeezing kind of feeling. So when some patient or anyone describe their pain like this, potentially it's not a heart-related pain. Potentially it's a bones and muscle-related. Okay? So when you have pain, maybe you start to think, is it really sharp pain or is it like a tightened pain? Roughly you have an idea that will help you stay a bit calm. Let's say the pain is sharp or like a knife. Okay. Second one, we are moving to the location of pain. So first one, we're talking about type of pain. Second one, we're talking about location of pain. So we go to the heart attack first. So other than the chest area, you have heart attack. Other than you have pain over here, anyone of you here know that what are the other potential area that it will show? Before I come into my course, become a physio, I also never know. Let's see. Just review the answer here. Yep. So you can see here, first one, around the chest area. Don't look at the picture first, you might get a bit confused. Okay. Around the chest area. Second, around your neck and your jaw area. Don't like this part. Okay. Neck. You might have the pain or down or tightness that radiates here when you have heart attack. Third one, your forearm, your finger. Fifth, upper back region. Okay, in general, the pain tends to be more diffuse, means that you're unable to pinpoint where is the pain. Like, is there but I cannot use a finger to point at where is it. I was just like, it's there, but I cannot really direct a specific area. So the picture is very famous in our medical school that everyone know. It shows that the area that potentially has chest pain. Yeah, so the second one is we call a tie, like wear a tie, right? So it look like a tie. So this way it come down. This where patient might have pain, and especially for the jaw area, it tends to get missed out. Patient tends to think they have gum problems or toothache. Go and see a dentist, and nothing's wrong. If the dentist is good, then potentially they can think can be heart-related issue. Direct the patient to see a doctor. Okay, the purpose I'm sharing this is that I want to increase the awareness of the general public to know that the heart attack doesn't really just happen around this area. Okay, it tends to around other part also. Okay, and with the type of pain that you feel, like what I shared just now, squeezing, tightening, burning, heaviness, around all these areas that I share, it tends to give you an idea what are the pains that you are having. Okay, and compared to bone and muscles related chest pain, the pains tend to be more localized. Means that you're able to use one finger, point to either your doctor or to whoever that, hey, I feel the pain is here. I feel the pain is in my shoulder and back. Like at least one or two fingers you should be able to pinpoint compared to a chest pain that you feel like I can't really say where is it. Okay. If let's say it's nerve related, probably you have a bit of numbness and tingling sensation also if it's related to your cervical spine, the thoracic spine. Okay. The location is a bit hard to say because it can be anything here because you have all the muscles and joint here. So how we differentiate as a clinician, how we differentiate is we use by whether they can pinpoint the pain or they say, like, I don't know where is it, but I feel something here. Okay, so we have 2 points now. The first one is the types of pain. Second one, we have location of pain. The third one is the aggravating factors. For heart attack, it tends to cause or aggravated by exercise or exertion, assignment, any other form of stress, and also cold weather and occurrence after meals. However, in most of the situation, there are no obvious aggravating factors. Okay, it's not hard to understand why there is no obvious aggravating factors because heart attack is an issue that slowly build up. Like you have high cholesterol, your blood vessels start to harden over the time. Okay, so it slowly go until the maximum point, then something happens. Okay, so it's not like you exercise a bit, then you strain your heart, then you heart attack. Okay, that's why not surprised that many of the cases there is no obvious aggravating factor. So start to take good care of your health now and do regular body checkup. So for bones and muscles related chest pain, the aggravating factors tend to be a specific body movement. For example, you don't have pain now, and you turn, I feel the pain here. You come back, the pain is gone. It's gone. Okay? Or you have a specific position. For example, you lie like this for too long, you start to have the pain. And you sit up, the pains start to relieve. That is another cue that the pains can be muscle and related. The third one, pressure or a firm touch. As a clinician, we use the word palpation. So we will feel here, and when I touch here, you say, painful, here all pain. So that is very an obvious sign that it is a muscle or related pain, like structure related, not related to heart. Okay, or rubbing, and you rub a bit, then the pain is here. Also another sign that is bones and muscle related, or stretching. You do certain stretching, I feel the pain here, then come back, then the pain is gone. Yeah, that means it is bone and muscle related. Another one is breathing. So many of my patients, they tend to say, I feel the pain when I take a deep breath in, but it's gone when I breathe out. Yeah, because when you're breathing in, you're stretching your ribs, muscles, or your joint. That's why it causes you the pain. Okay, so this is the third things that we will consider when someone tells us that they have chest pain. Okay, give me a minute. I see there are some questions in the chat box. Let's see. If
Yeah,
you
maybe
any
I could
question,
read
if
to
you
you.
sorry,
Maybe I could read to you the questions. Or do you want to leave
I'm
it to the
reading.
end?
I can read here. So
Okay.
does reflux have BP drop? Not necessary. When you have reflux, reflux, I assume you are talking about gastric reflux, right? It's not really linked to your blood pressure, but studies show that patients who are obese, especially your abdominal obese, where you have a big tummy, you tend to have reflux problems more because of all the pressure building around your stomach area, causing your gastric juice to coming up more easily. Okay, so BP, it doesn't really related to your BP drop. BP drop, it can be one thing we'll call postural BP, where you sit down for too, stand up, your blood pressure drop. But I don't think it related to. But I do want to share this thing where if you always have gastric reflux, you are higher risk of having cancer around your esophagus area, because reflux cause chronic inflammation around your esophagus area, and chronic inflammation tends to cause cancer. Okay, so there's one benefit. I ask my patient try to slim down a little bit, so they won't have always have reflux and reduce the risk of having cancer. Sorry, I'm sharing a bit too much now. What about fainting spells with pain? Whenever you feel like you are fainting, you should go and see a doctor immediately, because fainting is you'll say it's a life-threatening sign. Okay. So I don't want to comment too much about fainting here. And if you feel like you're fainting, go and see a doctor or go to a hospital. Okay. Liner Lim said, if it is muscle-related pain, usually how long it takes for the pain to subside, assuming that it is not a muscle tear? A very good question. How long for the pain to subside depends on how severe is it. Assuming it's not a muscle tear, I would say it's always not a yes and no question. It's a range of how much is the injury. Let's say if it's only a very mild injury, it tends to recover faster. If you get treated earlier, you also tend to recover faster. But if you ignore the pain when it's only at the mild area and it doesn't go and do something to treat, the pains might get more and more severe. And when it becomes a vicious cycle, because when the pain, for example, you have pain over here, when you sit upright, you tend to hunch a little bit, so you don't feel pain. And you stop looking for treatment, because by hunching, you feel better and you're not looking for treatment because you think you're weak. But they are not treating the problems. And it becomes a vicious cycle where you have bad posture and your muscle getting more tight, joint getting more tight because you're having a bad posture. And it becomes a vicious cycle. And it causes the pain to get more and your other issues start coming in. Okay, then it will take very long to subside. So my advice is it's not a yes and no question, is how early you get yourself treated and how severe is the problem. I have a lot of patients where they tried a lot of other treatment or self exercises at home, and they only come to us when their problems get a little bit worse or chronic or become a vicious cycle. So we have more things to treat them, and that tends to take longer to recover. Or they don't get treated when they are younger, and when they are older, they have a bit more problems comes in. So my advice here is get treated early. Any other questions, you can type here or you can unmute yourself. If not, we can move on to the exercises first, then we can continue with the question and answer. Okay. don't have or you are typing? Okay, let's move on to the exercise first. Then later, if any question, you can ask me again. I have a full video and articles in my website to share a version of this exercise. But for today, I just want to together with you. Want to a short one. I wrote here exercise to relieve your intercostal muscle strain, but not just relieve, it can help you to prevent you from having this muscle strain by getting more flexibility and also more mobile over your this area. So yeah, let's try it. But if you feel pain now or you feel pain during the exercise, please stop. This exercise specifically target the muscle strain, which is you can look at this slide. All the muscles in between your ribs. Okay, so if you have muscle strain around this area, one thing I will ask them, stretch it out a little bit. Okay, so they get a little bit more release of pressure, then they recover faster. So we'll do it in sitting. If you want to do it in standing, also okay. We'll have two position. First one I'm targeting is if you have pain around, I'm gonna move myself back. If you have pain around your lower ribs here, this part, and especially it get aggravated, for deep breathing, okay, this exercise help you to stretch out muscles over this area. So first one, let's say if it's this part, I will want to expand my ribs by putting my hands up and I lean aside. If you have a wall here, you can hold on to it. I will prefer you to do something. So you feel stretching here, hold it there. If you have pain, you should just hold it there. But if you don't have pain, you can continue to do a deep breathing, expand your ribs and the muscle a little bit more. So take a deep breathing and hold it there for 5 seconds. So you feel here, expand and 1, 2, 3, 5, and let go. Okay, one more time. Oh, 1, 2, 3, 5. Okay, this exercise help you to open up your ribs around this area. Okay, stretching out the muscles and improve your mobility around your ribs, and also help you to improve your breathing. Okay, depends on your pain area. If you have pain over here, you can adjust a little bit of your hand position. If you have pain a bit more front, you lean back a little bit. If you have pain at a slightly behind, go on the opposite direction a little, stretch it out the area. Okay, and if you're at this side, then you can just do this side. Okay, we do not do it in front because this part we don't have ribs. We don't really need to stretch it out. Okay, so that's the first exercise. And if you are really experiencing the pain, when you do this exercise, you feel a little bit of pain is okay. So from 0 to 10, keep the pain below 5. So about 3 to 4 is okay. Because when you have muscle injury, you stretch out a little bit of the muscle, it's normal to feel the pain. But keep it below 5. Okay. So let's say you do this already, feel the pain, and it's about 3 to 4, you should stop here, just do a bit of stretching. When you feel better, only then you add a little bit of deep breathing. Okay, but if you don't feel pain, take a deep breathing, see whether you feel the pain. Okay, but if you're someone who don't have pain, it's a good exercise for you to stretch out your ribs and improve your mobility. Second exercise, we are targeting at the muscles at the back. Okay, because our ribs start from here all the way to here. Okay, that's why we do sideways and we do front. See me. Okay. So I'll do it standing better. So curl yourself lean forward a little bit. You can help yourself. Stretching around this area. If you have pain, you should some stretching pain over here. Then you can hold it there for 5 seconds. 1, 3, 5, let go. Okay, one more time. Back forward, up your head. So we are stretching the back. And a deep breath in, further stretch. Okay, expand the lower ribs here. 1, 3, 5. Okay, again, if you have pain, just hold at the position where you feel the pain is around 3 to 4. When you feel the pain improve, you can either go a bit more flexion, or you can add in a deep breathing to increase the stretching. Okay, but if you do not have it, it's a good exercise for you to stretch out your ribs and to prevent any potential muscle strain and joint issue. Yeah, there's a 2 exercise that I have for everyone today. And if you want to learn more about this, I will share the link to someone share it. Oh, thanks, Marianne. Is it Marianne? Yeah, she shared the link of the articles and the video in the chat box. So if you want to learn more a full version of the exercise and a bit more information on intercostal muscle strain, you can go to the article. Okay, if you have any problems, you also can talk to me for a free consultation via the phone. We do free consultation to discuss your problem before you come and see us physically, so that to make sure that we are able to treat you or ask you to. Okay, now we go to our questions and answer session. Okay, anyone has any answers that you want to ask or any experience you want to share? Or you have any interesting topic that you want me to cover for the further the future webinar? You can share with me here. Joseph Chan. I tend to hunch my upper back. When I do push up, the lower ribs in sort of action. Yes, potentially. So when you hunch your back, your lower ribs tends to be a little bit more expanded. Okay. When your muscle actually in a long-term expanded position, the muscles tend to get a little bit weaker, and it tends to have very more easily back to a neutral position. So I will say that first thing you should correct your posture first before you attend the workshop. You might need, if you are someone who always go to the gym, you might need to consider to do some back exercises to prevent muscle imbalance from happening. So patient who tends to hunch their back, they tend to have more tight chest muscles and weak upper back muscles, where make them look a bit hunchback and causing a lot of problems, not just the ribs. They can have a blockage of their nerve underneath the armpit, because when you hunch your back, there's a nerve here get blocked. Then you might have tingling sensation down to your arm, and you might have shoulder issue also. Can you share how a physio can help, and what should a patient expect during the session? Okay. I think this question may be not really specific to a chest pain, but an overall. Yeah. So I'm targeting more for pain management. How a physio can help. We have different approach. We have active and passive approach. Any of my patients, they like passive approach, which means massage. Someone do massage for them, someone do ultrasound for them, and they can just relax and hope they recover. But sorry, that's not the truth. We do use active approach, where first thing we always use, exercise prescription, work out muscle that is weak, relax and stretch out muscle that is tight so you have a better posture. Muscle that is weak, unable to hold your joint in place and causing you posture problem, pain problem, and muscle that is weak tends to get injured more easily. Okay, and yeah, based on the issue, we describe different exercises with some massage, we're able to help pain. And what should a patient expect during a physio session? First one, of course, we do assessment, identify the root causes for your pains. Then we will discuss with the patient. Usually I will do two things. If the pain is very severe, I will try to do manage the pain first. Yeah, but most of the time, those quick fix for the pain is only short term. For example, dry needle massage, are only short term. We are looking more in a long term management to address the underlying issue, to identify why are you having this pain. Are you having a bad posture? Is certain part of your muscles weak? Do you need a certain specific exercise to prevent the injury from becoming? Certain patients, when they feel the pain is really disturbing them a lot, then will just ask me to do pain management for the first session. Then when they feel better, they will come back for subsequent session for me to sort out their root causes. I think that's more or less answer the questions. Is chest pain and chest tightness the same? It's I would say it's different. So just now I mentioned like I would say in overall umbrella term is a discomfort, and depends on the type of discomfort you feel. The clinician or the physiotherapist is able to see whether the discomfort is coming from your heart or coming from bone and muscle, and that is also one of the strong points of seeing a physio compared to other professionals, because we are medically trained. We have our rotation in hospital. We learn how body works and how medication in other conditions while we are in hospital. So let's say if you visit a physio with your chest pain, we need to make sure that the chest pain is not life-threatening, other than just manage your pain. Compared to if you see someone who are not medically trained, they can miss out the problems, and without doing a proper referral, without recognizing the symptoms, it can be something quite bad. If let's say you are having a heart attack and you thought it's pain, you see it, we call it red flags. Okay, so when we see patients with clear red flags, make sure they are not life-threatening life-threatening condition. If it is, then we should refer them out to doctor and GP. How do we differentiate the two? Differentiate by the types of pain, the location of the pain, and also the aggravating factor where I shared just now. But remember that it takes many years of study and experience for us to able to so-called diagnose and tell whether the pain is coming up or the bone and muscles. It doesn't, please do not go and tell other people or even self-diagnose yourself and skip your medical professional advice. Remember, this webinar is only add on to your general health knowledge. It's not to qualify you to diagnose yourself at anything. Okay. Jason Ning, what is a possible cause of localized muscle pain on the left chest area? How to avoid that? Possible cause of localized muscle pain. Left chest area over here. Potentially most of my patients that have very tight ribs or they tend to hunchback. Okay, so when you're hunchback, your muscle tends to get squeezed and shortened in that position. So when you're doing certain movement or certain sport where you need to stretch it out, okay, when your muscles are not used and your joint is not used to the position, it might cause some strain to the muscles. Okay, but it also can due to other things, maybe the sports you play, the picture you are on, or maybe the economic setting in your office. How to avoid that? I can't really advise. I can't really give a good advice without personal assessment. But I think good posture is something that always works. So make sure you are not hunchback. Always sit up straight. Not have forward head posture. Okay, open everything up. And if necessary, depends on your job nature, you might need to change your position a bit. If you're playing certain sport, you might look into the technique of you playing certain sport and it's certain part of your muscle being too. Okay, so how to avoid, make sure you have good posture. The rest I will really need to do an assessment to advise. I had a crash 3 weeks ago while writing. The impact was on the back, while the pain and bruising start recovered within 2 days. I'm still having pain at the right side of my rib. X-ray show no fracture. Could it be due to muscle tear? Usually result from a crash, right? One, I would say more of a contusion compared to a muscle tear, because muscle tear usually happen during exercise, certain movement, but your muscle can also injure contusion, and it's a body protective mechanism where when you have injury around certain area, you have a lot of other things ongoing, your muscle will get weaker, and because of the pain, might adapt to a new position. For example, hunchback, like what someone said, shared just now, he has pain, but he feel better when he hunchback. So he start hunching back all the while. Then he start to have other. Okay. So I would say muscle tear from a crash is unlikely, but you potentially might have a contusion. And because of the pain, the bruises, contusion, crash, you adopted a weird posture, and that posture potentially causing you other issues. So you see, it's a vicious cycle. You need to settle everything and get back to better posture, change out the muscle that is weak, and review your posture again. I hope that answer your question a little bit, like how to tell if it's heart or left chest pain. The two are around the same. Okay. Like what I shared just now, we go by the type of pain that you are feeling. Is it tightness, squeezing, burning, heaviness, or is it walking, nightlife, or sharp, jabbing type of pain? And also, where is it? And also the aggravating factor. Is it aggravated by specific movement? When you deep breathe in, breathe out, you feel the pain, and when you breathe out, the pain is gone. Or is it you feel it when you have stress, you feel a certain form of excitement, then you're able to differentiate whether the pain is coming where. But my advice, again, if you really have the chest pain over this area and you're not sure, it's good to see a doctor to clear yourself first. Again, this is not a webinar for you to self-diagnose, it's a general health knowledge for you. If it's only pain, that means problems. If shoulder blade side seem bruises but no pain. Priscilla, your problem seem like more like a bone and muscle related kind of pain. Bruises. I'm wondering how come you have bruises. Is it from a contusion or you're having certain medication? Also depends on other factors like age, your other medical condition. Certain patients who are on blood thinner tend to have bruises more easily because they tend to bleed more easily. And for patients older age, you also need to be more careful. So my suggestion is that your condition seem a bit more like muscle and bone issue, but also depends on other factors. Good to see a doctor first and get a proper referral. But if you prefer to see a physio, you can just give me a call, then we'll see how can we proceed from there. My left neck is achy and pain. My left shoulder joint pain at my left that's me. How can I assess? It happens after chest tightness and reflux. It happened after my chest tightness and reflux got back. It potentially can be two issues. When the pain start radiating down, can be a nerve issue, but depends whether you feel tingling or numbness, or you just feel discomfort. If you had chest tightness, I suggest you to see a doctor because chest tightness is a sign of heart-related issue and a heart attack. Okay, I suggest you go and see a doctor, get a clearance first. The doctor say it's really not heart-related. Eventually, you want to see a physio to clear yourself. We have this terms called thoracic outlet symptoms, means there's a bunch of blood vessels and nerve around this area. Z to your hand, and when you hunch back too much, all this structure, your nerve, your blood vessel get blocked, give you problems to your lungs. Okay, so what we will do is need to break their posture, turn up their muscles, open up the tunnel here, so they can have better flow and better way for all the structure to go through. And we have a tear on supraspinatus. Yeah, I think that's what you mean. Supraspinatus. Other than the keyhole to repair, is it any treatment? I have been to physio and it doesn't help. Okay. When you have something, when you have a tear in the muscles, okay, yes, you need to fix it. But other than fixing, you need to retrain your brain and your muscles on how to reuse and adapt to the posture again. Because when you have pain, most of the people, even for me, I have some pain over my knee also last time. You tend to adopt a position that is more comfortable, it's not painful for you, while you wait for the pain to recover. But through this period, the body adopted all this abnormal posture. And when your pain recovers, this posture stays on and it gives you a lot of other issues. For example, muscle weakness and back posture, and you feel like you are not as strong as last time because the doctor they just fix the structure but they do not look through your exercise, your daily activity, joint mobility. That's why need a physio to help you. You have been to a physio, it didn't help. Maybe you want to come to us and have a try. Most of our patients, surgery and CS, they tend to recover at least 90% because we tend to look at the process for the issue and channel. If you play sports, we do sports rehab. I hope that answer your question. So surgery to fix you, but you need a physio to rehab you. Any other questions? No more? Any other questions, Marianne?
No, I don't see any other questions. Maybe last
Good,
call,
that's a
any
lot
other
of-
questions? Yeah, but it has been a very engaging session. I think you
For
answered.
anyone, you have topics that you want me to share in the future, you can type it down and let Marianne know maybe.
Yeah, that would be great. It will help us to in curating our topics as well. Yeah, so for the past webinars, we did on back pain and sleep. So maybe if there's any other topics, feel free to let us know, or maybe Gan also could go through now before the webinar ends.
I have an idea of in Chinese they say 多水不平衡. So imbalance in my ear. It tends to get misdiagnosed also, and not many people know that as a physiotherapist, we also train to treat the imbalance in the ear. With certain position, we can help you to diagnose whether the dizziness that you feel is really coming from the ear or from the other structure. And if let's say it's really coming from a ear, we have different maneuver to help to reposition and exercises to help you to get it sorted out. What happened I feel is that many of the patients who come, they have it for many years, and they do not know that actually as a physio we are capable of treating it. So they come to me, oh, I should have known you better. Then they suffer for 1 year, they come to us and they get treated. Because I think the general knowledge about what does a physio do still not as good. Some people still think we are like a masseuse, we are not. We do a lot of other things. Stroke rehab, cancer rehab, any treatment for tinnitus. That one, if really a true tinnitus, then you need to see a ear, nose, throat doctor to really fix. Can you do a session on how to treat plantar fasciitis? Yeah, sure. There's a very common issue that we see in the clinic. And yeah, that is a great idea. maybe
Thanks for the
Mary can.
idea. Yeah, I'll take that down. Yeah, and if we have future webinars, we will also broadcast that on our channel and yeah, to you guys as well. Thanks for the idea.
Okay,
Yeah.
really enjoy the session with you, and thanks for all the questions.
Yeah, thanks, Gan, for doing this. It was very, very insightful, especially, you shed light on the symptoms and aggravating factors. I thought that was quite interesting, especially the part about the jaw one. I didn't know about that. Yeah. So before we end, I would like to share the website as well. So maybe you could take a look. Maybe Reti, maybe you have to stop sharing for Gan.
Sorry.
Yeah, I'll just quickly share, your website. Let me just quickly share. Yeah, so this is the one that Gan was talking about, the muscle strains, some exercises. So you could, we will also send an email to you guys, and we can just attach this so that you could check out the full video on his YouTube. Yeah, and also just wanted to share more about our website. So we recently launched. This is how it roughly looks like. It's calibrateapp.co. So you could also search based on specialty. So in this case, let's say for Gan, I'll search physio, right? Yeah, and then you can also search by conditions. So that's where, let's say if you got back pain or hip pain, knee pain, that's where we try to narrow down our practitioners for you. So in that case, I'll just for demo purposes, I'll just press search. Yeah, and then this is where you can see the different for example, physios. So let's click on Rehab. Yeah, and this is where you can see Gan's profile. So you can see other photos and also read more about his session. So you could also directly book on our website. But if you would like to have a consultation with Gan first, please feel free to do that. Yeah, and you can also read more about Gan and all of his different partners. I'm sure your partners also have a lot of experience, 9 years, 7 to 9 years. So yeah, this is one way where we try to have transparency with our users. So you can, read more about their certs and everything. Yeah, and could just find out more about them in general. And you could also see the sessions. So for example, Gan has different sessions like physio for pain management, sports recovery, pre and post. So there's a lot of different specialties for Gan and also home physio. So over here, you could also do a simple booking. Yeah. Gan, would you recommend to do a consultation first? I think you're muted. Yeah. Okay.
Yep. If they have problems, they are unsure whether they should see a physio, I welcome them to do a consultation and call me first. But if they know, right, they have been seeing a physio, they have already post out where they definitely need a physio, they also just book the session. Yeah, so I'm fine with both. Because some clients prefer to talk to me first. I'm fine with that.
Yeah, sure. I think that works also, depending on your, your level of comfort on what you want to do next. But we could also drop these links in the email, and yeah, that's just a gist of what we do at Calibrate. And also thanks so much, Gan, for sharing. I think everyone is also leaving soon. I think it's close to the end of session. So thanks everyone. We'll just follow up with an email feedback form, and if there's anything, feel free to reach out to Gan or myself on Telegram. Yeah. Okay, thanks everyone.
Bye bye.
Bye bye. Thank you. I'll just end the session now.